Hello, I am Dr. Jayanth. Today we are going to talk about a condition called Perthes disease. Perthes is a condition where there is a temporary loss of blood supply to the ball-shaped upper end of the thigh bone called the femur. The upper end is called the femoral head. The femoral head has a unique blood supply and it is therefore prone to getting interrupted in some children. It typically happens in boys between the ages of 4 and 8 years. Younger children can also rarely get Perthes, and it also happens in older boys. Once the blood supply to the ball of the femoral head is interrupted, the body then undertakes a prolonged period of removing the damaged or affected bone and replacing it with new bone. When this process of healing happens, the bone becomes soft and it can collapse, particularly if the child is very active, and typically boys between 4 and 8 years are extremely active. So the normal weight bearing forces that go through the hip joint causes this ball to gradually collapse. Once the bone collapses, it loses its round shape and it becomes flattened or sometimes mushroom shaped. During this process, the ball can also gradually come out of the socket, and it is this femoral head deformation that causes problems in later life. If the condition is not treated at the right time, it can result in stiffness in the hip, it can result in a limp, it can cause a difference in leg lengths, and eventually some adults who had Perthes in their childhood, they can end up with early arthritis in the hip. That's all in terms of basic information about Perthes. I will tell you about diagnosis of Perthes and treatment in the next video. Thank you.